Welcome everyone. This is the second sugar morning that we've had so far, and I guess the last one of the year. Today, our topic is going to be Ozempic, as most of you know. Joining us is Dr. Curnew, as always, and we have Judy, our diabetic educator and nurse. I'll give her a chance to jump in if she wants to introduce herself quickly.
Yes, good morning. It's a great pleasure joining you all this morning, as well as joining Dr. Curnew's fabulous team there. So look forward to seeing many of you, if I haven't met you already, in the new year.
Wonderful. So I guess
a little bit about yourself, Judy. Tell us a little bit about yourself.
Sure.
How long you've been working at Mac and everything. A little bit about yourself.
Okay, so I've been a nurse.
Funny story about yourself too.
Okay, so this is my 40th year of nursing. And for the last 20 years, I've worked at McMaster in the diabetes adult clinic, and currently am working still there and working for a third-party company that Dr. Curnew has made me more than busy in the 2 days that I've been there, helping to explain Ozempic and teach the injections and answer any questions as well. And I'm a certified diabetes educator as well. And I love this line of work. It's wonderful. And you guys are so inspiring. You've got a great coach there and all his other coaches. So congratulations on the whole team and you guys.
Thank you, Judy. Thank you. Right. So I guess we'll get into it. We'll talk a little bit about our table of content. Judy will also get a chance to jump in later on. Just to begin, we'll talk a little bit about our clubs. I'll let Mira jump in to talk about the weight loss crew. Unfortunately, Aditi wasn't able to join us, but she leads the cooking club, which we'll talk about in a second. And then we're going to talk about Ozempic, what it is, what it does, injection procedures, and different doses that are available, as well as some things, along the way. And there will be a Google form that Nurmi is going to post in the chat. Feel free to fill it out to follow along. We already have over 20 responses, which is really, really encouraging. These are different people who include their SMART goals, KCCQ, which we'll talk about in a second, different availabilities, because as part of the sugar mornings as well, we're going to call you after and just work with you individually. So that's also an option for you. And so just fill in your availability, different goals you have is going to be something that's pretty helpful. And just an example as a SMART goal. What is a SMART goal? So SMART goal stands for specific, measurable, attainable, realistic, and time-bound. As an example of something, a SMART goal that I have is to be able to do 10 flights of stairs without getting tired and run at least one of them up. This is, we do the stairs Monday and Fridays, Dr. Curnew and I, whenever we're able to go. And so I want to try to do 10. But to be measurable, I sort of want to work slowly. And so Mondays and Fridays, I'll try to do 3 to 4 at a time. And so slowly just creeping up and increasing and overloading. In terms of attainability, I think it's pretty attainable, right? Just working slowly and pushing it up. Realistic, I think 10 would be realistic, considering my maximum right now is around 6 to 7 when I get really gassed out. And so I want to try to push it to 10. And time, give yourself a timeline. I'm not going to say I'm going to do it tomorrow because that's, unrealistic. So I think time bound around April 2022, which is when our school ends. It would give me adequate time. So I encourage you in the Google form to fill in, and there's the exact same picture on the Google form. So if you want to follow along that way, I encourage you to put in a SMART goal that you think might be something you're interested in working on. And the KCCQ as well on the Google form, you'll find a quick video sort of introducing it, there's a Google Sheets that you could follow along and sort of calculate it. But essentially what the KCCQ is, it stands for the Kansas City Cardiomyopathy Questionnaire. And it's a great way to measure your symptoms, physical and social limitations, quality of life. It's especially for heart failure patients, but it's very useful to help us track progress, see if gone better or worse, even if you don't have heart failure. I use it, often with my father or with just people I think would benefit from this. And we'll talk about the cardiomobile as well. That's something that we use it for as well. Okay, awesome. Mira?
Hello, thank you so much for having me on. My name is Mira. I'm from the weight loss group, which is another group that we have at the clinic. Our goal is to help you lose weight. So we talk about a bunch of different things within our initiative. So we talk about diet, exercise, but also motivation and psychological tips for weight loss. So we also have Zoom meetings, but ours are on Tuesday evenings from 7 to 8 p.m. on Zoom. And if you go to the next slide, you can see a nice picture of me and somebody that I work with, Devanshi. We're both students at McMaster, and we both study in the health sciences and physiology programs. And this slide shows what we do. So our main thing is the Zoom club meetings that we have on Tuesday evenings. We talk about lots of different things related to healthy eating, exercise, and motivation. And we have a little bit of a discussion at the end, what works for people for weight loss, keeping each other motivated. And it's really good just because everybody gets that opportunity to talk to one another in the process of achieving a similar goal. If you're not a keen person on Zoom, we also have one-on-one calls, which happen Tuesday evenings between 4 to 7 p.m. and also Saturday mornings starting at 10 a.m. So that's a way for a volunteer. We'll call you up and we'll talk to you a little bit about weight loss, what you're doing for that so far, and keep you on track with your journey. And some tips that I have for keeping the weight off through everything that I've researched with the club is to exercise. So studies find that even non-vigorous activity, so like walking around, helps. A lot of people part of the club, they'll do things like walking around their apartment, walking around the block, and that is totally helpful for weight loss. Another thing that I find is helpful is choosing long-term lifestyle changes. So something that you're able to keep up over the long term, because that just means that you'll be able to achieve these goals easily. And then staying consistent is also helpful. Just because weight loss is a long-term thing, it's not something that can unfortunately be achieved within like a couple of days. What I've personally learned for the group is staying positive is the most important aspect of everything. Just keeping that optimism and that positive attitude going goes a really long way. There are tons of people within our club who are super successful for weight loss. And what they all have in common is that they're constantly optimistic and they always want to like keep moving and keep getting over challenges. We also have some videos on Dr. Curnew's YouTube channel.
Yeah, there we go. I was just gonna mention that. Yeah, so these are some videos. We have playlists. If you just go to youtube.com and just search Dr. Curnew, you'll find all these different videos. And if you press on playlists, there's different ones on motivation, congestive heart failure, women's health. And if you just keep it at home, which is the default, you'll be able to scroll down and find a bunch of videos.
So we're going to start a competition over here if we can. Is that one of the things is that SMART goals. I want people to fill a SMART goal. And one of the SMART goals I want people to say is try to form a habit. And one of the habit is that we've actually worked really hard. We have well over 200 of these videos. So let's see how many nights someone can do this. 5 minutes every day, let's say either first thing in the morning or at nighttime. Now, if people have sleeping problems, I know exactly what to do. Put on one of the videos and you'll fall asleep watching it. But what I like people to do is that let's actually have a little competition. How many consecutive days people can actually spend at least 5 minutes looking at any of our videos? Who's game for this? And then we'll have a prize for that. I have to think what the prize will be depending on duration here. So who's in on this?
We are.
All right, so we have Karen there. Good.
Yeah, I can do that.
Perfect. So just make sure that everybody just on your SMART goals, I'm going to spend 5 minutes. And what also too as well, if you want to put some comments on some of the videos too, we love feedback as well. Share it with others and things of that nature. Yesterday's one, we had really one on mental health, and I learned a lot, and I was amazed at the interaction we had. So that was really another good one. They're all good. One of the things is that I want people to be a little bit kinder to ourselves, better sleep. I've actually, probably the most influential video to me right now, one was Dr. Goldchuk about better sleep, better quality sleep. So I've actually worked on that. I think I was averaging 4 to 5 hours of sleep most nights. I still don't sleep enough, but I'm sleeping better. I'm more conscientious of that. So So please, everybody, just take a look at some of these videos. Good. So I like that idea. Great. Go ahead. And one of the things is Mira's club is phenomenal. You know, when I join in, join out, I always feel a little bit charged. I learned something. I'm motivated. I learned from things from konjac noodles to kombucha and just how the power of working together. Go ahead there, Adam and Nurme and Mira and all the rest of the team there.
Sure.
Right. Yeah. Already here. Perfect. So here we have our links to our Facebook group. I'll put all of these in the chat so everybody can take a look, but it's a great way to connect with other patients, other people in clubs, and also other club leaders. Okay, and here you can see the clubs now. And there's a Google form here to join these other clubs. So if you're interested in joining either Mira's club or we'll talk about Didi's club on the next slide, or even other clubs like part of our 30 and 30, losing 30 pounds in 30 weeks club, any of those clubs, you can just put all that information in this group and this Google form, and we'll be able to kind of reach out to you for that.
I'm quite intrigued about losing 30 pounds in 30 weeks and keeping it off there. There's actually very good data that people who have diabetes and lose 30 pounds who are overweight can put their diabetes in remission 3/4 of the time. Hard challenge to do, but very doable. I'll just remind people if they're not on talking, if they can just mute their mics, that would be great so we don't get as much background noise. But they're all wonderful. One of the things is that mindfulness group on Wednesdays, I've become I think a better person, better doctor, and a better human being by joining that. And first of all, I want to thank all these young people for making me a better person. They've done a great job, and they'll make you better too as well, if you allow them.
Thank you. Yeah, and I mean, just being here is the first step. Right? It's just also about taking action on a lot of these things. A lot of these videos, like diabetes into remission, different clubs we have, everything's available to you, all the resources. It's just, you know, taking that step and making those goals. And so on this slide here, oh, here's another club. Okay, I was going to talk about Ozempic. So here's another club. Maybe you want to chat about that quickly because Aditi wasn't able to
Sure,
join us,
yes.
Unfortunately.
So this is Aditi's club. They meet once a month on Sundays over Zoom, 4 to 6 or 2 hours. Basically send out the ingredients and things like that beforehand. You can go buy your things, or you can just hop on and just kind of watch Didi make her meal. And then when she's making her meal, you can kind of play along and kind of cook the meal yourself. And they're very healthy meals. I know the next one, I think it's on the next slide, but we'll be talking a little bit about more like holiday kind of meals. So here's like an example of what they actually do. You can see that, you know, there's a lot of recipe demonstrations, a lot of cooking, good conversations, and they just have a lot of fun. So 2 hours, you know, of your time, but, you know, you get to learn a lot about cooking. And the theme for tomorrow is actually going to be holiday foods. So might be very important with the holidays coming up. And then here's a possible recipe. So you might have heard of something known as Jollof Rice. This is very similar to Jollof Rice, but instead of rice, they've used quinoa this time. And you can see that the ingredients are all here, and I will paste the recipe in the chat for everyone to try at home if they want to.
So one of the things is that I learned how to use an Instant Pot. I didn't blow up the world. I make my homemade hummus. You can batch cook. I make enough for multiple meals. I freeze a lot of things. I learned so much from so many people. It's so much fun. We have great discussion. You know, should I eat egg? Should I eat meat? Should you know, quinoa, for instance, is one of those superfoods. And that if you're going to have flax, you should grind it up. You want to make chia pudding, overnight oats. It goes on and on and on. And if you really want to show us off your cooking, bring a little sample to the clinic. We will never say no to healthy foods and things of that nature as well, and bring it to your friends and things of that nature. And Aditi couldn't join us today because she has a power outage. at her place right now, and she's a phenomenal cook. I learned about, how to use a crock pot, how to use Instant Pot, how to convexity, all these different oven properties, or should go the top or the bottom. But more importantly, it is fun, educational. You'll learn a lot and you'll try something new. Most of us eat about 10 different foods, and we can modify them to be better. If one of the things is that we're gonna have a little lot today. Most of all the white foods in this world, white sugar, white flour, are unhealthy. They have a high glycemic index. They're bad for you. They make you eat too much, and avoiding processed food is a problem. So I want people to think about what white foods that you can eat, and I'll give you 2 examples: white onions and some skim milk. So I want people to put in the chat box a couple of ideas what white foods are healthy that you can eat. Let's go to the next slide there.
Yeah, and so
Perfect.
just one other thing is
go for
the
it.
book. Sure. Yeah. So just 30 Days to a Healthier You, that's the book that we made at the clinic. Dr. Curnew and some of the wonderful volunteers here, they wrote it up. It's $30, but all of it goes to charity. I personally have 2 books at home, one for me, one for my dad. He's really, really enjoying it. Despite a little bit, even of a language barrier, he still thoroughly enjoys it. There's a lot of recipes, a lot of really useful information. And so I really encourage you to check it out and just really get into the action phase of things.
So this book took about 30 years to write. This can be 130 or 30 days. This can be 10 times 30. My hope is that people keep reading it over and over again. It tells you about the science. It tells you why cholesterol medications are important, why vitamins don't work, some good recipes, some science, sense of humor. And it's a book I'm very proud of. I never thought writing a book would take so long, and it probably had 10,000 drafts to it. Very proud of it, and it's the best I can give you of information. I hope everybody at some point in time reads the book, practice some of the things there. It will make you a healthier person, and get it for a friend or whatever. Right now, I know like BC having flood problems, so we're going to take some of the money for that. We're going to send it to them. There's about 20 or 30 charities we normally give at this time of the year, and if you have any suggestions, please let us know, much local as possible. And of course, providing vaccines for the rest of the world is important. And it looks like we're all going to need booster doses of the vaccines. And so anybody over the age of 50, I remind you, once you make it to 50, your immune system starts to waver. And so a 20-year-old has a great immune system, a 50, 60, 70-year-old has a weaker immune system, and it weakens as time goes on. So think about all the vaccines. We have lots of good webinars on vaccines. Take advantage of that. And please enjoy the book, and please participate. So we have the program 30 pounds, 30 times, 30 months. That's this is going to be a key part of our strategy. So thank you, and thank you everybody for reading it. And I hope you find it helpful. And we're working on actually 5 other books, and that will take another 25 years. So I have to be in practice for at least till I turn 100. So, and that's my goal. I plan to retire when I turn 100 if all goes well.
Wonderful. Yeah, so I guess the show, the main part of the show, the Ozempic. What is Ozempic? Just to talk to us a little bit about it. So Ozempic is medication initially used for type 2 diabetes treatment, but it's really been found to have great benefits with weight loss and promoting weight loss. I have some sports references here, Dr. Curnew and I thought might be interesting to look at. For those of you who don't know, this is Kawhi Leonard, who helped the Toronto Raptors reach their first NBA championship in the Raptors' history. He really played an integral role in helping them win. And so to us, if we take Kawhi as, for example, the Ozempic, he could play a really important role. And why wouldn't you have a superstar like that on your team, just to give you that little bit of a boost? Because the Toronto Raptors were good, but just needed that boost a little bit. Same with here, Alphonso Davies. I'm personally really big fan of soccer. And so Alphonso Davies here is the one who's one of the key star players for the Canada's national soccer team, is helping us get to the qualifications for the World Cup. And so actually yesterday, he was on the Forbes 30 under 30 sports list for the most influential people. And so again, he represents our webinars. So again, it's just like having these little superstars on your team just give you that little bit of a push would really be helpful.
So to me, for a soccer team or a basketball team or any sports franchise or your health team, you look any successful franchise, it's a team approach. You need key people. And to me, Ozempic is Kawhi Leonard, is Alfonso Davy. This medication can be an instrumental part of weight strategies. It has helped me achieve my goal, but you can't win a championship. You can't achieve success with just one superstar on your team. It's a whole team strategy. Ozempic is a superstar, but it's also, like any of these superstars, quite expensive, and we can talk about its cost and how to keep the cost down as much as we can. It's now being approved for weight reduction. And so to me is that we'll talk more.
Sure. Yeah. So again, like Dr. Curnew mentioned, it's just one part of the piece, the big puzzle. But so generally it's injected once a week, around the same day. So if you take it, for example, today and Saturday, then you take it again next week on Saturday. And you may want to give it around 8 weeks or so just to really start to feel the effects fully in terms of the benefits. And so I'm going to spare you a little bit of the complex physiology and just how it works and all that, but I feel like it's going to give us important background and just a little bit of the science to help you understand. So Ozempic is just part of the class of medication called the GLP-1 agonists. So it works by binding to the GLP-1 receptors and stimulate insulin secretion in your pancreas. And so it helps with reducing blood sugars if you're diabetic, but also suppressing appetite, which is really what we care about for weight loss and just helping you control your portion sizes and eating habits. But yeah, so I guess just a question for Dr. Curnew and Judy here. So if I don't have diabetes, does the Ozempic make my blood sugar go too low, or what should I know about it?
You're not going to get low blood sugar if you don't have diabetes, because the mechanisms in your body to sort of balance out your blood sugar are still working. So you're not going to have a low blood sugar. And even if you have diabetes, unless you're taking a lot of other different medications, perhaps even insulin, then you're more at risk. But it just helps improve versus really being the culprit of a low sugar. But definitely, if you don't have diabetes, that's not going to be an issue.
Yeah, it's quite interesting. It only lowers blood sugar if your blood sugar is high. It stimulates insulin, and insulin lowers blood sugar. But the mechanisms that's really intriguing to me, because it works in your GI system, it slows gastric mobility. So you get a sense of fullness, and you have to eat slower. If you try to eat too fast on Ozempic, it's like going on the 403 during a traffic jam. You're going to get frustrated because you can't move. The food just doesn't move as fast. So you feel the sense of bloating. You can get this fullness. More importantly, it goes right to the brain and has receptors in the brain that block appetite. That's independent of its blood sugar effect. So when the first time I took Ozempic, my plate was half full. I didn't finish. Usually I finish your plate as well as mine, and I didn't want to do that. So now I found that Ozempic helped me achieve my weight loss goal. I use it every once in a while at this point in time. And some people in Mira's team use it every day because they have diabetes. They need to lower their blood sugar. And some people non-diabetic will use it like once every 3 or 4 weeks. Some people use it really depends on your circumstance. And so we're supposed to use it every day. And that's a conventional way of doing things. But I'm going to show you some different ways of thinking about this. Kuwait Liner is no longer a Raptor at this point in time. Toronto is not a superstar, but they're rebuilding. So what Ozempic taught me is how to manage my eating habits better, my activity, and just how to live better. And to me, this whole group support is really important, but Ozempic can be an integral part either on a regular basis or intermittently, and we're going to show you different strategies along the way. The biggest downside of it's the cost of therapy. Each one of those pens is about $240 at this point in time. It's covered in Ontario for diabetes management, so the age of 65. It's not approved for weight reduction in Ontario. The approval process will show that, but question who will pay for that's a very interesting thing. People with private insurances. It's useful for diabetes, but to me, I'm not using it necessarily for diabetes. I'm using it for weight reduction. And if you haven't lose 20 pounds at least on this drug, I don't think it's worth taking it for the vast majority of people. So I think that's where I'm thinking. So when we have this 30-pound weight reduction, this can be one strategy. You can still win a world championship without Kawhi Leonard or become a qualifier for the World Cup without Alphonso Davies, but it sure makes it a lot easier to have superstars on your team. Keep going, guys.
If I talk?
Yeah.
That Moen one you were looking at, how much was that roughly? The one you
Sure. Each pen is about $240, depending, with including dispensing fees. And we're going to show you how to just hold that thought for a second over. I'm going to show you some ways to really dramatically reduce the cost. I'm a penny pincher. I'm half Hungarian, and basically I grew up. We don't throw anything away, and we get good value for the dollar. And I'm going to show you to get good value for the dollar with Ozempic.
All right, so hi everyone, my name is Regan and I'll be going over the injection procedure for Ozempic. So for the first step, you're just going to prepare your pen. You want to start off by washing your hands and you want to check to see the pen window to make sure that the solution is clear and colorless. And if it isn't, then it's better for you to not use the pen. You will put a new needle on the pen and you should use a new needle each time that you use the pen. And you're going to pull off the outer needle cap and then the inner needle cap and obviously discard both of them. For the second step, you will check the Ozempic flow, and this should be done before the first injection that you do with each new pen. But if you already used the pen before, you would have already done the step and you can just skip it. So to check the Ozempic flow, you will hold the pen with the needle pointing upwards. Then you will turn the dose counter until it shows the flow check symbol, which will look like 2 dots and a line. You will press and hold the dose button until the dose counter shows 0, and you should see a drop of Ozempic at the needle tip. If you don't see a drop, then try repeating the process up to six times. And if you still don't see a drop, then try replacing the needle and trying again. And if it still doesn't work, then it's better to not use the pen. So for the next step, you will select the dose, and this is pretty straightforward. You're just going to turn the dose selector until you see your dose. So it can either be 0.25, 0.5, or 1. For the next step, you will inject the dose. So first you want to wipe your skin at the injection site with an alcohol swab. You will insert the needle into your skin and hold it in place and then press down and hold the dose button until the dose counter shows 0. After the dose counter shows 0, just count slowly to 6 before you remove the needle from the skin, just to ensure that you're getting the full dose. And lastly, you're just going to remove the needle from the pen after you take the pen out, obviously, and then you're going to place the used needle in the sharps container, and you can get a sharps container from your pharmacy, and then you will put the pen cap back onto the pen. And as you can see on the slide, there is a video demo that goes through the exact same steps. But if you're more of a visual person, then the demonstration might be very helpful for you. Next slide, please. In terms of where you can inject Ozempic, there's 3 different places: your abdomen or your belly, the thigh or your upper arm. It's just very important that you don't inject your muscle or like any veins and you're going into the skin. And you can use the same area each time you inject Ozempic, but you should change the specific spot where you inject within that area. So if you choose to inject in the same area, like your abdomen, for example, just make sure that you're not injecting it in the exact same spot as you've done before.
Yeah, Dr. Curnew, Judy, any thoughts here before I guess we move on?
The only thing that I would say about the injection is that certainly if you come to the clinic, we're giving you the samples of the 4 millimeter. You do not need to worry that it's going to go into muscle. The needle is very, very tiny, and so you'll be good for that. I know on here it says not to sort of recap, take that big cap out, but I often find putting that large cap back on and untwisting, and then you won't be poking yourself with a needle because it's pretty tiny. And for most of us, our eyesight isn't all that great. And so it just makes it a little bit easier.
Yeah, so one of the interesting things is that the hardest part I got myself is like taking off the needle and pricking myself with the needle. The needle is so small you can barely see it, and it's not even a prick. It's just a little thing. And once you inject yourself, you hear a click at the end of it, and then count to 6 after that click sensation. Now, what about refrigeration and no refrigeration, Judy? How should we approach that?
So I usually recommend that because you're giving it once a week, just to leave the pen in the fridge, particularly once you get into your money saving ideas there, that the pen may last a little bit longer than typical. So I usually recommend leave it in the fridge in between the doses. You might want to take it out a little bit before, maybe half an hour before you're going to give it. Some people find a cold injection a little stingy, but most people tolerate it very well.
Yeah, I think the best place is to keep in the fridge.
Yeah.
Great.
Awesome. Thank you. So I guess we'll talk about doses quickly. I have a quick video that I'd like to show. Dr. Curnew and I just took it yesterday. I'm just going to play that video right now. So let me just put it up here. Can you guys still see?
Yeah, we can see.
Awesome. Let me know if you can hear.
We have Ozempic. It comes in 2 size pens. This is actually called a 1 milligram pen. And if you look at the 1 milligram pen, it has 4 milligrams in this pen. And the second pen is the 2 milligram pen. And these are for doses 0.25 and 0.5. Now they're the exact same price, and you get twice as much in this one compared to that one. So when you first start off, we often start with 0.25, go to 0.5, 1 milligrams, even higher. What you can do to reduce the cost in half is get this 1 milligram pen, which contains 4 milligrams, and actually count your clicks here. If you can see on this pen here, I can hear 1, 2, 3, 4, 5, 6, and you keep going forward. And if you go all the way, it will go to 1 milligram.
It's our first video. I'll just play the second one quickly. That one talks about the actual clicks. Yeah.
Nice car.
Oh, thank you. It's not mine. I wish. It's an Aston Martin. I'm not rich enough to buy it.
I guess the person who can look at our videos for the next 10 years, 5 minutes a day, will get you a car. How's that sound?
That sounds great. It would be a dream.
Again, when I'm using the Ozempic, I can actually count 19 clicks. 1, 2, 3, and keep going. And 19 clicks will be 0.25 milligrams. 37 clicks will be 0.5 milligrams. And 74 clicks will be 1 milligram. So basically, you cut the cost in half by using the 1 milligram pen. So don't be afraid to just discuss cost of therapy. Now, how much should you use is actually quite a challenging situation. The standard dose is 0.25 starting off for most people, and then you can decide you need 0.5 or 1 milligram. Some people use it every day because it lowers their blood sugar. Some people use it once a week, every 2 weeks. I personally use it once every couple months or so right now when I'm going through a difficult phase right now. But we have to find out what works for you if that's what you want to do. So, weight management is a complex disorder. One of the things is that my brain always wants to eat, and basically we have neurotransmitters. This actually does 2 things. It goes to my stomach and slows my gastric emptying, so it's trying to get on the QW when there's lots of traffic. I have to eat slower and more mindfulness, and if I eat too fast, I may get some GI upset and maybe some diarrhea. And also blocks my appetite center in the brain. I'm not saying this is for everybody, but this is certainly one choice. And many experts believe is that we're getting away for weight management, we have to think about brain and decreasing appetite. So this is one potential solution. It is an expensive drug. We should talk whether or not you have coverage or not. At times I'll be glad to provide samples when available. Presently, we have what I call the Ozempic nurse or weight management nurse that will help us with that. We have our team that really wants to help you in this domain, and so this is one option to use. So let's explore it. Now, can anybody figure out in that, there's one mistake in that video. Can anybody get it? I said you can give it every day. You give it once a week. So the standard way is once a week. So one way to reduce the cost is to basically use that 1 milligram pen, or has 4 milligrams of Ozempic. I'm always amazed, if you went to the supermarket and you had 2 boxes of Tide, a big box and a small box, the exact same price, we'd actually get the big box. When it comes to medications, people want to take the small box. So I want to encourage you to use the 1 milligram pen. Those samples that we get is for the red box or for the starting dose. So we don't get samples for the big doses here. And this is what we get here. So you can see that the standard dose, it comes in a red box. It's 0.25, and traditionally we go up to 0.5, but and eventually to 1 milligram. You can actually go over 2 milligrams now, and that actually shows a even better weight reduction. And we'll talk about that more in the future. But right now is that, and it's nothing magic about 0.25. 0.25 may be too much for you, and you might need to go up to a full milligram. But everybody's is different. And you can go in between. You don't have to say, it's sort of like this is the basic recipe, but any good chef knows is that you have to modify the recipe to yourself. And I learned along the way is that from many people from Mira's group is that there are difficult times where you're losing control. That's why you're going to go on vacation. Now, first of all, if anybody decides to go to Mexico to all-inclusive, or going on a boat cruise where you can have 7 breakfasts before 7 o'clock in the morning, it's going to be pretty hard to lose weight. So if your goal is to lose weight, don't do that anymore. We stopped our vacations that way. When we go on vacations now, I haven't been on vacation for God knows when, but we usually rent a place. We get our own food, and versus all-inclusive. So yes, it's nice to be on an all-inclusive, but I don't have the willpower. I have terrible willpower. And I'm going to show you something. If you go around my house right now, is that we're under construction. We have what I call the no kitchen right now. And my wife likes it because look at our kitchen. There's nothing in there. We have a toaster, a microwave oven, and we have no food in the house. So Carrie and I have lost a lot of weight. We changed our behavior. So maybe you should do renovations or close your kitchen or something. Found that to be quite helpful. And one of the things about eating, there is a neuroscience to the brain. There's an appetite center, but there's a lot of learned behavior. One of my learned behaviors is nighttime eating. I'm hungry all the time. Some people snack, eat 6 times a day, intermittent fasting. There's all different strategies you can look at. And sometimes I'll fast one day here, different times here. But Ozempic really can help you curb your appetite. It's a remarkable drug.
Hello.
Next slide, please.
Right. So like Dr. Curnew mentioned, we usually start off with a 0.25 just to give us a little bit of a taste, just to get your body used to it a little bit. And then we move up to the 0.5 after obviously discussion, just seeing where you're at, if you feel any symptoms or side effects and so on. And then we could push as much as we want to like 1 milligram and anything in between, really, like we discussed.
So traditionally, 1 pen will last you a month. But let's say you just did 0.25 milligrams, and that's what the dose that you require, and you use the small pen, that will last you 8 weeks at $240. On the other hand, if you use the 1 milligram pen or 4 milligrams in there, that same thing will last you 4 months. And so it depends on your dose. So you can know, and you can say, well, maybe I don't need it every week. Maybe I do need it every week. So So the initial price is expensive, but there's so many ways to make it so much more cost effective. I find to be honest with you, somewhere between 0.25 and 0.5 is the dose that I find. If I take 0.5, I'll throw up. And 0.25 is not quite enough. So somewhere in between those, you do some extra clicking there and playing around with that. So take a screenshot of that, people, and we'll have this posted there too as well. So these are ways to do that. And you know, right now we're being blessed that we do got a fair bit of samples. Will that continue? I don't know. Right now it's a relatively newish drug, and not too many cardiologists are prescribing the medication. I found this to be a very, very useful drug. Does that make sense? Any questions about the dosing scheme, anybody?
If you only have 6 needles in your box, how can you use it for more than 6 doses?
Yeah, so two things. One, you can buy extra needles, or number 2, reuse your needles. So in theory, by the strict rule of the law, you shouldn't be reusing needles, but they're, you know, I'm not sharing needles. I'm going to keep them sterile. I'm using them for myself. I'm going to recap the pen. I'm happy reusing needles on myself. But that's an individual decision to start off with. The way I'm telling you to use the drug is not, the company would hate for me to tell you about this. I'm going against they don't want me to tell you this. But I'm telling you because this is important to you. I think it's a phenomenal medication. I'm just, the price is the issue. And I'm just saying, you know, I can reduce the price in half, even make it even 25% of the cost, depending on the dose that you're using, or even a fraction of the dose, depending on multiple factors. So if you're going on vacation to an all-inclusive in Mexico, I think I'd cancel the trip or fire you for lots of reasons. We shouldn't be traveling right now, number 1. And number 2, but if I was going to do that, I would take 1 milligram of Ozempic and throw up on in the buffet line and not want to eat. But that's just one component to that.
I have a question.
Sure.
Okay, so I experienced a lot of side effects with it. And I was talking to the nurse. I don't know if it was Judy or whoever's from your office. And she suggested that, sorry about that. I'm supposed to, I'm on the 2nd month now. So I'm supposed to increase the dose. But she suggested that I do less dosage. Is that okay?
Yeah, so what you can do is, so if 0.25 is making you sick to your stomach, that's too much for you. You can start slower. And most people will adapt to that over time. The fact it's like Buckley. I mean, Buckley tastes bad because it works. Ozempic should make you feel queasy to your stomach.
That's what I feel.
And it's a question of how much it's going to make it and what's the dose that you're going to pick. So you can go less than 0.25. So there's no magic rule to that. So if you're sick at 0.25, going higher, you're getting sicker. So if you don't like somebody, I'll take a milligram right on the first day. So if I like you, I'll take half a 0.25. Take less next time. Your body will get used to it. So there's so many ways of dealing with this. It's like, you know, a recipe. You know, this is what most people use, but what you need will be totally different. Some people are very sensitive to it. And for some people, it doesn't work at all. But for most people, it does have a contributing factor to that. Great question.
Okay.
I used to, sorry, just to add.
I'm not done. But like it doesn't show the number. It only shows the clicks. So the nurse told me to do maybe 13 clicks. How much milligrams is that? 13 clicks. Okay.
So depending on size of the pen that you have. Judy, you want to join in and how you help people with their clicks?
Well, I normally would say, you know, to sort of go in between. We're not to an exact science because it's not sort of a life-saving medication. You're somewhere in between a 0 and a 0.25. I think once you get into those low fractions, it really doesn't matter. If 4 clicks work better, that's what I would say, and not necessarily worry about the milligrams. If you're not tolerating it, and that's the worst side effect to the medication. If the side effects are mild, work through it. Sometimes you just need to skip a week and start again the following week.
Oh,
Some
I didn't know,
people can- some
I didn't
people
know I
can-
could do that.
Yeah,
I didn't
some
know I
people
could do
can take a little bit of Gravol. That will help as well. And some people, as Dr. Curnew say, just do not tolerate this medication at all. And that's why we start you off slow
Oh,
and that you can adjust it. So if you go to 0.5 and your symptoms worsen, but 0.25 is not enough, then we can just sort of go in the middle.
okay. Thank you
Okay.
very much.
You're
Thank you.
welcome.
So
Just
go ahead,
to
Stephanie.
add,
Yeah,
so
go ahead.
just to add, my name's Stephanie. Hi, I'm kind of in a unique position because I'm a diabetes educator, a dietitian, and I used to work for Saxenda, which is a very similar medication to Ozempic. So what we would advise patients to do, and this is just my 2 cents based on that experience, is if you can't tolerate a higher dose, to stay at the dose that you can tolerate for another week, or 1 or 2 weeks until the symptoms subside and then go up again. And I don't know if it's different with this pen, but we used to say that the clicks in between, we couldn't verify the dose. I don't know if it does actually change the dose in between. I've never, I guess I'll experience it myself now because I'm taking Ozempic, whether the full pen gets used with the clicks in between, I don't know. But just to throw that in too, I'm not sure what the doses are actually verified to be in between.
Yeah, so this is not I'm just giving you a framework how you get the dose adjusted to yourself. But so I want you to feel free to experiment and try different things.
Okay.
And maybe just taking out the pen will make you stop eating. It will scare you a little bit more. So to me is that knowing it's like having a spare tire in your car. Knowing you have it makes me feel more confident. It's kind of interesting for now is that I rarely have to take it, but I know I have it. And I find that really a good psychological support. And also a good, it's one of those things that to me, a couple of things that helped me on my weight loss journey was that my son, who had to lose about 60 pounds, hates exercise, got a personal trainer, lost 60 pounds, and he said, I don't like the calories right now, and I'd rather not eat. I said, holy cow, I love the calories, I'd rather exercise. So he hates exercise, so he lost weight by forcing himself to exercise. I was just at the gym this morning so I can eat more. And but if my son, who I've been thinking can do this, I can do this too. And at one time we had a strategy is that every time I ate after 7 o'clock, I would pay him a couple bucks. And so he just put a video camera on the fridge, and he's a multimillionaire at this point in time. And I think that car belongs to him now. So different strokes for different folks. But this is really a game changer. It's sort of like having Kawhi Leonard on your, or Alfonso Davies on your side, on your team. And those who want to learn how to use it, that's why Judy is part of our team now, and maybe Stephanie will become part of our team too as well, is showing you how to get started on this. And don't be afraid to experiment.
Sure. Yeah. So, I mean, we talked a lot about doses, and I think this is really productive discussion. And I'm glad everyone is engaging and just sort of sharing. But sort of going back to Kawhi Leonard, and he was being paid $30 million a year when he was in Toronto Raptors. But how can he make it cheaper, right? Like we discussed cutting it by half. There we go, right? What if you're able to pay him $15 million? And that's because, the 4 milligram and the 2 milligram pen cost the exact same. And we just have to adjust the clicks and just sort of work with that. And so 19 clicks, like we discussed, is 0.25, 37, 0.5, and then 74 clicks is 1 milligram.
And don't worry if it's not an exact science, like I'm not sure if the clicks always work. I forgot my clicks, so just gives you a ballpark figure to that effect there. I wish my salary in the clinic approached Kawhi Leonard's, but I do think is that Kawhi Leonard really made the Raptors. Took him I don't know how many decades to win a championship, Kawhi Leonard can't win the championship on his own. You know, is if you need a whole, and I look successful people, they surround themselves with successful people. And so be careful, just pick the right people as part of your team. Sometimes your team members may be sabotaging you in some way. So take a look at that. Take a look at how to find the right combination that works for you. Any questions about the dosing issues at all?
I have a question.
Sure.
Oh, go ahead.
Sorry, I have a question. If the dose you're on, 2.5 does nothing, you don't feel anything, should I increase it to 5?
Yeah, 0.5. Yes, exactly. So
Okay.
if you find a dose that works, you stop. So I found
Okay.
that 0.5 was too much, 0.25 wasn't enough, somewhere in between was helpful. And I'll never forget, my wife heard me retching in the kitchen and said, "Oh, you took Ozempic again, did you?" So you know, you have to find that spots you. But I also think it's you know, there's so many things behind, so many layers about weight reduction. You know, it's not all just about food, it's not all about exercise, it's about you know, your mental status, your sleep, and how you feel. And I really felt this is like felt I had Kawhi Leonard on my basketball team, or Alfonso Davies on my team. Now they're not good enough to win the world. I have to do all the hard work, and that's why I like our book, 30 Days to a Healthier You. That's why I like our SMART goals. That's why I like all these young people here. They really can make a difference. You know, heart disease starts the day you're born, and most people have their heart attack 50s, 60s, 70s, and 80s. It didn't happen overnight. Diabetes, the time you make the diagnosis of type 2 diabetes, half the cells that make insulin are dead. The rest are working overtime. And so it's not so bad, it's just like diabetes. Well, having half your cells that make insulin dead is not a great thing. When people find out they have heart disease, you know, it's like a catastrophic event. You have plaque in your arteries all year. I have wrinkles in my gray hair. We all have some degree of plaque. I just don't want that plaque to rupture. And weight is a crucial factor. Here's a question to people. So a 20-year-old that's born today, if someone's born today, when they turn 20, or what's the estimated incidence of diabetes that's going to happen in an average 20-year-old 10, 20 years from now? Does anybody know? What percentage of Canadians will develop diabetes?
Maybe.
Sorry?
40%?
Yeah, it's estimated to be 50%.
No.
So right now, roughly somewhere about 10% of Canadians have diabetes. It's growing every time. It may be 20%, maybe under, but to say that, you know, like, so, you know, we have to think about how to change our eating, exercise, or way of doing things. So we ask things about, you know, glycemic index is one component. We have some videos on that. So all the white foods are bad for you. White sugar, white flour, white rice, white bread. So some of the white foods that are good for you will be cauliflower, egg whites, skim milk, white onions. Can anybody think of any white foods that are good for you? White garlic.
Yeah, garlic.
No.
Tofu. Hummus and beans.
Yeah, good, excellent. And by the way, there's actually very good data that adding beans is my second Ozempic. You add beans, you feel full, bloated. It actually suppresses appetite. I live on a farm and we have soya, and I take a bunch of them, I put them in the freezer, and then I cook them myself. I boil them up and I put them to everything. I love those, you know, canned beans and with maple syrup. So I put half of those beans in there and half of my own soya beans or other beans as well. So I mix and match certain things. So be creative in your cooking and look at some of those videos. That's why I really appreciate Didi's, how she taught me how to be a better cook. I learned last month how to make hummus, and hey, it's not so hard. And I used my son's instant bullet that has been sitting around that he hasn't used in a long time, and I froze the leftover and had some. When you saw that picture of me getting that Ozempic demonstration, that was after being in clinic. I couldn't fall. I couldn't go home the night before. I didn't finish till 10:30, so I stayed in clinic, went for a walk that morning, and we made that info commercial. But out of the freezer, I had frozen hummus I took out and put it on some brown bread. There you go. So So just try that. Any thoughts for anybody else about that? Great sharing. Next slide. Judy, any thoughts as well you want to share on that?
No, all good, all good.
Okay, great.
All righty, perfect. So as we wrap up, we just want to think about some considerations that you need to make. The next slide. There's a lot of things that we need to consider, and we've kind of talked about this throughout our presentation today here. But we need to consider, how we're going to be using the Ozempic. Do we have diabetes and we're using the Ozempic mainly for diabetes, or are we using it mainly for weight loss? Or maybe even both, The other thing we need to talk about is, of course, side effects. We're not going to lie, there are side effects that do exist, but these side effects can be mitigated, or we can learn to deal with them. And so that's kind of important, right? We don't want that to be a factor that scares you away from potentially trying this drug out. And then finances. So I think today we've talked a little bit about, how to make Kawhi Leonard a cheaper player for our team. We've talked about how to reduce Ozempic costs. And the main thing is to figure out, how can, we support you the best for your journey on trying to use Ozempic, or trying to control your weight loss, or trying to control your diabetes. And, one of the ways that we can kind of help is just by talking to you. So if we go to the next slide, the bottom line is to chat with your family doctor, or to chat with Dr. Curnew or Judy, or one of the volunteers on the team, to try to figure out if, Ozempic is right for you. And then Dr. Curnew, or someone on the team that you have will help, figure out what the best approach is for yourself. Everybody is different, and, the goal is to figure out how we can add this player to your team in the most efficient and most effective way possible. So those are kind of the small considerations that we wanted you to make. And I'll pass it off to Adam here to talk about Dr. Ganguly's program here.
Sure. So this is Dr. Ganguly. He's a gastroenterologist and a physician colleague of Dr. Curnew's. I'll let Dr. Curnew speak to him, but talk about him quickly. But then they have a food is prevention program. That's what they're calling it. It's a 6-week program that starts in January. And I really encourage you guys to join if that's something that interests you. We have our email address here. You need a referral to be able to join. But definitely it's something that's interesting, something that's going to be really useful. I guess before I play the video, Dr. Curnew, do you have anything you want to say here?
Dr. Ganguly is a great colleague, great friend, but he is the opposite of me in the sense is he wants to do everything with diet and lifestyle changes. He's a vegetarian. You can see it the before and after. He's lowered his triglycerides. He's lowered his blood sugar. He has a phenomenally wonderful wife that's supportive of all this. And he's put up a website called Food is Prevention. He joins us for most of our Sunday cooking classes with Aditi. I love this guy. He's certified in vegetarian eating, and he's going to offer a group of our patients starting in January, a 6-week course. Let's play the video first, and we'll talk a little bit more about that afterwards. So this is what here's Dr. And there's different approaches, different strokes for different folks. And I just want to show you Dr. Ganguly, wonderful guy. And here's what he has to say.
Hello. My name's Dr. Ganguly, and Dr. Curnew asked me to spend a couple of minutes explaining to you my food is prevention program, which he's been involved in and supported for the last few years. I work as a gastroenterologist here in Hamilton. And just as a way of introduction, what kind of got me into all of this is that several years ago, I found that I was pre-diabetic. I suddenly realized I didn't want to develop diabetes, and I didn't want to end up being on drugs. So I decided to go back to the medical literature and to see if I could prevent my own diabetes from developing. So what I found was a very big study, 3,000 subjects who were pre-diabetic like me, and they randomized them to a lifestyle intervention of aggressive exercise and a healthy, low-fat diet with a goal of losing 7% of body weight. They followed these subjects, and after 4 years, for every 7 people who did a lifestyle intervention, they were able to prevent 1 person from developing diabetes. But even more interestingly, they followed these people out for a total of 15 years. And 15 years later, surprisingly, 52% of them still developed diabetes. This was very disappointing to me because I really hoped that I would be able to prevent diabetes. So I was a bit discouraged at that point. So I went back to the literature and I kept reading. Here you can see results of a different study that I found. So in this study, they took 100 people who already had the type 2 diabetes. Half of them, they put on the American Diabetes Association diet, and half of them, they put on something called a whole food plant-based diet. So the horizontal axis is time, and they're measuring HbA1c, a very interesting blood test, which basically averages your blood sugar for the previous 6 to 8 weeks, a very accurate way of seeing how well a person's diabetes are controlled. What you can see is that within about 2 to 3 months, there was a prompt separation of these 2 curves, the light brown being the American Diabetes Association diet, and the black line below being the whole food plant-based or the vegan diet. Prompt separation of the lines, they stayed separated for a full 74 weeks, which is a year and a half, which is a very impressive result. Here are the results of a different study that I found later on. This is a randomized study of a small number, 48 people with documented coronary artery disease, so narrowing of the arteries on angiogram. Half of them followed the conventional care at the time, and half of them had a lifestyle intervention with meditation, relaxation, and essentially a whole food plant-based diet. They did a repeat angiogram at 1 year, and then another angiogram 5 years later to look at their blood vessels. So what you can see is they both started with about 41% narrowing. The vertical scale is percentage narrowing of the vessels. You can see that the patients in the control group, standard of care, the black line, black dots, got more narrow 1 year later, 42%, and even more narrow 5 years later at 52% narrowing. However, the lifestyle intervention group at 1 year were less narrow than before, from 41 down to 38%, and at 5 years, it was 37%. So it went in the opposite direction. I found this very surprising indeed. So there's a photograph. I ended up adopting a whole food plant-based diet somewhat reluctantly. And there you can see the photograph of me beforehand and afterwards. I'll let you figure out which is which. After that, I learned how to build a website because I thought my patients might be interested in learning about this too. So here's my website, which you're welcome to check out. It's foodasprevention.com. And I literally walk you through the evidence for heart disease, for obesity, for diabetes. I talk about supplements, I answer frequent questions, and then I suggest concrete things you can do if you're interested in adopting a whole food plant-based diet, what to have for breakfast, lunch, and links to hundreds of recipes. So that's foodasprevention.com. But I've also started a special program to help patients who want to do this. Specifically, the research and literature has shown that the best way to adopt a plant-based diet or to make any lifestyle change is to participate in small groups. And so I see patients in consultation, and if they're interested, I allow them to join some small groups. We run currently a 6 weeks small group intervention. So we meet on Zoom on the internet. So approximately 1 hour meetings every Sunday night for 6 weeks on Zoom. So if that's something that interests you, feel free to talk to your physician about getting a referral. So I've made a special webpage for people about this program if you want to learn more about my program. So you go to my website, foodasprevention.com, and then you go /patient, P-A-T-I-E-N-T. And there you'll see a specific page which explains my program to you. But like I said, I see you briefly in consultation, occasional follow-up visits, and then you have access to these Zoom meetings. There are 6 meetings once a week for 6 weeks on a Sunday evening, roughly 1 hour. So who is this for? It's for patients who are interested in adopting a whole food plant-based diet. You need to have email and you need to know how to use Zoom. And if you're not the one who does the cooking, if your partner does the cooking, it would be lovely if at least they come to the Zoom meetings. Unfortunately, we don't have access to a dietitian. So right now there are a few patient groups that we can't work with, Specifically, if you have kidney failure, your creatinine is over 200, if you're on a drug called Coumadin or warfarin, or if you've had bariatric surgery. But if that changes, we're happy to let people know. And these referrals are specifically for people who want help with a plant-based diet. If this interests you, like I said, feel free to discuss it with your doctor about getting a referral. Thanks very much.
So Dr. Ganguly has been successful. Now he actually bikes to work. He practices what he preaches, and he's extremely knowledgeable. And so to me, you can see that if you're going to rely on a medication to do it, it's not going to be successful. And there's also bariatric surgery, which is something we can talk about for the right situation. But Ozempic is like having Kawhi Leonard on your basketball team. And having Dr. Ganguly is another Kawhi Leonard or Alfonso Davies on your soccer team. So you can decide some approaches. Obviously, you can combine multiple strategies. And I think we have to combine multiple strategies. So though he's going to start a program for just our patients starting in January. So if you're interested, please let Nurme and Adam know about this. I think it's on the Google form, and we'll get you a referral. But this, you have to be serious about it. He doesn't want people. This is a rep team of vegetarian guru eating. If you don't want to do it, he doesn't want to see you. You know, doesn't expect perfection, but this is what he believes, and he will give you the tools. Do you have to be totally strict? No, but you have to be really pointed hard in that direction. I do think is that the healthiest diet for the planet is plant-based eating. Remember, for every pound of protein that we feed our cattle, it takes seven pounds of plant-based food to make 1 pound of animal protein from cows, and it's very hard on the environment. For chicken and fish is about 3. So for the animals, for the environment, plant-based eating is recommended for your health as well. So I'm not saying you have to do it every day, whatever, is that I became a plant-based eater a number of years ago. It started as a bet. Now, if you serve me meat, I will never throw things away. I don't want to throw anything away. 50% of the food that we consume gets wasted, so please don't waste things. Having more plants, and you can decide how far to push this, but there's good science saying that we have a trial called Direct and Broad that showed you can lose these 30 pounds to keep them off and put your diabetes in remission. So Adam and Nurme have done a beautiful video about putting diabetes into remission. That's why this, so different approaches. You can use myself, Adam, Nurme, Dr. Ganguly, Judy, next door neighbors, friends, enemies, all this to work. Maybe Ozempic, maybe not, maybe bariatric surgery, but please do something because someone born today has a 50% chance they will develop diabetes in their lifetime, and we have to change that. And it's not going to be one solution fits all, but we have to do something more about that. So I love Dr. Ganguly, but he wants people that are really want to go in that direction.
Awesome. Thank you, Dr. Curnew. And yeah, again, if you're interested, just email us or just either let myself or Nurme know. And in the Google form as well, you'll get the chance to talk about that. So if that's something that interests you, you could definitely do that. And again, just keeping in mind that a lot of these things that we discuss about, working in small groups, the accountability, setting SMART goals, a lot of that you're going to still see here. It's not just a magical 6-week program. You're still going to have to put in the work. You're still going to have to try. You're still going to have to set these SMART goals and just get yourself accountable, and maybe finding a partner of some sort that could follow you on this journey. And we're here. We're here for you. And I think a lot of these, everything pretty much we talked about except the medication Ozempic is free. And even we could provide you samples, right? And so we're here to help you. We're here to support you on this journey. And so I think that's very valuable to sort of keep in mind.
Hello.
Right. That's another program that I guess I want to talk about quickly, the CardioMobile program. So that's pretty quick. Okay. CardioMobile is just this little, very, very small device here that you can see. It's a 1-lead ECG device, which basically just measures the heart rhythm. And you can connect it to your phone or tablet, and again, it's just another way to track vitals and just see how things are progressing that way. It's a very small device. It's very neat. We have a couple at the clinic. And again, if you're interested, just email the clinic and we could definitely get you sort of started on that. And so it's again, another vital, another thing that we could do. And so to support you, blood pressure every day, it's one of those things that just fluctuates a lot, and just saying, oh, it's pretty normal. Usually it's just not, doesn't really make sense because blood pressure just goes up a lot. So just keeping a blood pressure reading and vitals, just sort of to see how things progress over time. Walking up to 3 times a day, again, walking, exercising, just getting the blood flowing inside you, that's very valuable. Measuring the cardiomobile if you feel any symptoms. Ideally, again, with sort of going back to the walking, measuring the cardiomobile before and after. And again, we can talk about these things in more specifics if you're interested, but before and after, just to see if there's any difference in heart rhythm, if there's something that, you feel, if you're feeling any symptoms, that's something we could talk about. The 6-minute walk test is this really neat test that we try to do once a week. It's for 6 minutes, you put 2 cones at like a specific distance, let's say 10 meters apart, and you just sort of walk for 6 minutes. And then you measure your steps and during that time, and then you see if you've gone worse, if you've gone better. It's kind of like, for example, the KCCQ, where we measure it before and after to see how you progress, if you've gone better, worse. It's just another measurement. So a lot of these things are just measuring. Going back to the SMART goals, just setting these measurements throughout the way and checkpoints, so you know if you're going back or forward. And again, just reading and following the 30 Days to Healthy You book, as well as our webinars and our YouTube. And just you being here is one step in the right direction.
So that's actually, if you just backtrack one slide. So this is an exercise-based program. So what we'll do is that we'll provide you with a cardiac mobile device for probably a couple months. It fits on your smartphone if you have one. We want you to walk, at least do something 3 times a day. We're going to start off with a standard 6-minute walk test, the Kansas City questionnaire. We're going to see if your quality of life and your fitness goes up over the next couple months. We strongly recommend you follow the program 30 days to a healthier you. If you need the cardiac mobile device or a blood pressure machine, we can provide that for a period of time. And I think this is wonderful that we just started that. So this is one of the pivotal features is activity. I know we all have different aches and pains. The number one way to treat your arthritis and your pains is to find some form of activity that works for you. Obviously, don't take the cardiac mobile in the swimming pool, but going for a walk and some form of exercise. So a couple of us already did some exercising today. It's wonderful. So this is something we can help support you with too as well. Adam and Daniel have been really instrumental of keeping this going. We just got that started as well. So we've had a couple of groups go through this. So that's wonderful.
Yep. And like Dr. Curnew mentioned, it is. Yep. It's just just one more thing. It's just I was going to say, because it's an exercise-based program, I've already spoken to a lot of people from the weight loss crew actually, and not necessarily for diabetes or the 30 and 30, just people that at the clinic maybe were interested. And so we gave them a device, and a lot of them have found it motivating because of these checkpoints. You kind of get a little bit competitive with yourself. You're like, oh, last week, for example, I went down and went up. And so just these little things along the way. But yeah. And so just on the last slide, this is just the conclusion. I really want to thank everybody for coming in. Our next meeting will be after the New Year's. Usually we do the first Saturday of every month, but the first Saturday of next month is January 1st. So it's New Year's. I know a lot of people might be busy and a lot of things are going on. So we're just going to do January 8th. And obviously we'll call everyone to remind them and just let everybody know.
So what's going to happen is that Nurme and Adam and his team is going to try to make personal contact with everybody who's on this meeting today, and people sign up and just see where they're at this point in time. Those that want to come in and see Judy, get started on Ozempic, we're going to arrange that. People who want to get on with Dr. Ganguly will have a talk with you, make sure that's what you want to do. That's wonderful. I love that guy. Tomorrow we're having our cooking on Zoom between 4 and 6. Everybody's welcome, and usually I'm on that one, but the Forge are in their playoff game tomorrow at 4:30. So I'm going to be at Tycat, or I guess Tim Hortons Field, we should call that now. The only good food on Tim Hortons Field right now is the food you sneak in, by the way, that you're not supposed to, and the Tim Hortons coffee there with a little bit of milk. in there. And but it, I don't know about you. When I go to Tim Hortons Field, I always want to have some bad food there. So I bring it. I put some nuts in my pocket, some peanuts, and I just eat my own nuts there. And but I eat too many of those things. And last Sunday I went to the TICAP playoff with Nurse Elizabeth. Nurse Elizabeth is 88 years of age. She survived a stroke. And we went to the TICAP game last Saturday. My first time being in the stadium in I don't know how many years. But because she's not very mobile, we just sort of sat there for the game. So I couldn't go to the concession stand. So it's good. So so much to think about. So any questions or discussions from people, and don't be hard on yourself. Just try different things, and don't be afraid to experiment, because Einstein said this well. Insanity, doing the same experiment over and over again, expecting different results. The results aren't different. So you have to get outside your box. Got to try something different. And I hope we gave you some ideas from Dr. Gangouli's plant-based eating, somewhere in between with ourselves, or with our weight loss, exercise, cardio mobile, monitoring your health, different strategies, but try multiple things.
Dr. Curnew, it's Pat. That plant-based eating program, is it set meals that he'll put you on, or he just giving you a list of things that you can eat?
Yeah, so what will happen is that you'll meet for 6 weeks, 6 Sundays in a row, and he'll give you some suggestions. He'll teach you how to cook, for instance, plant-based eating, and there'll be some demonstrations, sort of like what Aditi does once a month, but he'll do it at a more higher level. And he is going to be a group probably between up to 20 people, and he'll just take our patients, and he'll do it periodically right now. So he's eager to start in January. So if we have 20 individuals, and I suggest doing it always with your spouse is important. But he's sort of like a no nonsense guy. He hates pills. He hates people. He believes very strongly in plant-based eating. He'll show you science that he believes very strongly in. The science is not as strong for any diet. There's lots of great diets out there. So I think the number one priority for most of us is our weight. So if it's intermittent fasting that works for you, if it's a healthy high keto diet, you can explore that. I do think that the best diet on the planet for environment, health, and the animals is plant-based eating, and with more beans, and how far to push that. It will be up to yourself, but he really wants to push that aspect quite well, and he does it very well, and he knows so much about that. He's very inspiring. But
okay.
He's Sergeant Major when it comes to plant-based eating.
So worse than you.
I'll share a little story. Last night, my daughter was at my sister's-in-law, and I had to go pick her up after a webinar and stuff. And she just had her wisdom teeth. She's not feeling too great. She says, "Can we stop by at Wendy's?" And she said she wanted a drink and French fries. And so we get there, and I was looking at the menu. The only thing I can think of, they don't have anything. So I had a grilled chicken burger there. Yeah, sandwich there. Yeah, so it was delicious. But normally I wouldn't pick that, but these are the circumstances. And I took 2 of her fries.
I did the same thing with my granddaughter. She wanted a burger. And I thought, what am I going to eat? And I had a grilled chicken on a whole grain bun. So that's what I had, and no French fries.
But it's kind of interesting, the no meat burgers that they sell right now, they're just the same calorie density, saturated fat, bad food as a regular hamburger. They're not any healthier. They're just plant-based eaters. But Dr. Gangili will teach you how to make your own plant-based burger with beans and things like that as well.
Yeah.
So
all right.
He'll give you that healthy
That's
choice.
what I'm interested in. Is I like those veggie burgers.
Well, you brought it up to me when I was in the office last week, but all I said to you was, I have to talk to Pat. Pat does all the cooking.
So my favorite treat is go to Harvey's. Their initial plant-based burger, the initial vegetarian burger, on whole wheat bun. You can pick vegetables, avoid the mayo and all that sort of stuff. I find that very, very helpful. So that's my treat. And I have salad, and usually someone there has some French fries there, so I steal a couple of French fries. But you know, I think I was born hungry. I think I'm going to die hungry. But right now I have my body mass index around 24. Well, how long this will stay, I don't know, but I'm enjoying trying. I'm not being I'm not being judgmental. I'm just saying this is like what COVID taught me is any body mass index north of 24 kills. I was just looking at the ICU data from COVID. You know, people who survived being in the ICU, half of them are dead a year later after the ones that have survived. The mean age is 57. These more males, most of them are overweight. You know, high blood pressure, diabetes, overweight causes viral infections, leads to a weaker immune system, and it kills. Has more cancer. So to me is that one of the things is I said to myself is I don't know if I'm going to get COVID or not, but I want to be in fighting shape. And fighting shape is getting my weight down. And so I can do all the right things. I've gotten all my vaccinations. I'm looking forward for my booster shot. I do know once you make it to 50, your immune system starts to fail. Right now I'm 62, and if I want to practice till I'm 100, I got to do a lot of things to keep myself going and healthy. So as long as I can contribute and keeping my weight down and working with everybody and these young people here, the young people make me younger. And I want to really thank all these young people at McMaster. They made me a better person. Thank you.
Well, you have too, Dr. Curnew. It's been over a year now, right? And I've lost 47 pounds. I've done the Ozempic, like you asked. I've done the exercise. And anybody who's listening today, I think Ozempic works. It's worked for me.
I've lost 65 pounds, and you know, I've been doing great on it too. So
I think it's for us, it's worked really well.
So I'm wondering, should I go up on it? Because I've been at 2.5 and I'm kind of in a plateau. Do you think I should try a little higher, or we can talk Tuesday?
Sure. So one of the things is, I think, Pat, you use it every 3 or 4 weeks. Is that right?
Every third week now. Yes.
Okay.
Yeah.
And you use how much? 0.25?
I do 0. I couldn't do anything higher. I tried once, but it really made me feel nauseous. So I've stuck to 0.25.
I've always done 2.5 and I'm okay with it. So I'm wondering, should I go up a bit?
Sure. Well, I just want a couple of things about that. So Pat, how much exercise do you do?
I walk 30 kilometers on average a day. So, or more. It just depends on what I have to do that day. But I walk up and down the mountain. I do the stairs, and I've lost 47 pounds. I'm trying to get to 50. So I got 3 more to go, but my BMI's gone down to 21%. So I'm one of your success stories, Dr. Curnew.
So Pat is one of these people that, you know, eats predominantly plants, works with her husband, is a faithful follower in Mira's and Devanchi's weight loss program. Tony's very supportive. He often walks to work and bicycles. So Ozempic is just one ingredient about that. And we can talk about the pluses and minuses of that. We can certainly do that. And you know, is that you guys far exceeded expectations, but you can see is that I think is that your teamwork, your commitment to everything, and having Ozempic is you're the child posters of what we're trying to achieve for everybody. So, but you can.
Well,
see
I think I'd like to try that plant-based thing then.
So see, I'm in now.
By the way, here's my most important advice to all the guys here. There are 2 ways with arguing with women.
Yeah.
Neither one works.
No, yes.
What is the saying? If she ain't happy, you're not happy.
Yeah.
I better not say this, but she might actually hear this. I don't know why we're doing renovations on our house. I kind of like the way it looked before.
Well, we've been married 42 years, so we must be doing something right.
But any other questions? That's wonderful questions. Any questions for anybody else?
No. So I'll email you. We'll probably try that with in January then.
Yeah.
Wonderful. Okay, perfect. Sure. So everybody fill out the forms, send them in, and we're going to do a couple of draws for some prizes. And one thing I hope everybody will think about doing is 5 minutes every day, look at one of our videos. Think about, I'm looking over your shoulder, so to speak. And encourage everybody else to get the proper information. I'm tired of bad information. Am I right? I don't know. I spent my entire life thinking about this, and I want to share what I know. Look at other approaches. Dr. Ganguly is certainly one approach that I respect very much, and he's shown things to work. I'm quite impressed how Ozempic can be a part of your weight management team if you choose that. But it's only one component of that. So I look forward to wishing everybody a great holiday season and a healthy holiday season. And remember, is COVID hasn't gone away, so be careful. You know, I'm seeing too many people come to clinic with a mask below their nose. I don't know why you're doing that. If you want to kill me or somebody in my clinic, wear your mask below your nose. But right now is that there's over 1,000 cases in Ontario. We have these, COVID's not gone away. So I'm gonna get myself in the best fighting shape possible. I never thought I'd be going to a football game or a soccer game. They're outdoors. You're 35 times less likely to get COVID outside compared to indoors. Be safe, be healthy, and get healthier. And next year will be a great year for everybody. I'm sure it will be. Judy is a new member of our team, and she's been terrific. She has to learn how to use our electronic medical record. I'm still learning after 5 years, and that's why we have these young people that are helpful. And we'll be bugging each and one of you about your thoughts. Special thanks to Mira and her team, and Jerry and their team, and Adita and their team. Is that there's so many people on their side. Use them. They'd be glad to. I guess we're gonna call it a day then, okay?
Okay. All right, we'll see you Tuesday.
See you
All right,
Tuesday.
thanks.
Tuesday
Take care,
night.
guys.
Okay.
Thank you.
Bye, everybody.
Bye
That
now.
was very, very good.
Very good.
Thank you all.
Thank you.